Good afternoon, everyone. As you're arriving in, as you know, we'll just give it a minute to let everything warm up here on the Zoom. So we'll be with you in about 30 seconds. I'll start in. Thanks. Okay, so my name is Cliona Sadler, and you're all very welcome. I'm the Executive Director of Rape Crisis Network Ireland, and thank you for coming to our webinar, which we've called I Can See Possibilities. This is a quote from a survivor who participated in the statistics the RCNI are launching today. And we hope for us, it resonates with what statistics do in terms of revealing and showing a roadmap forward. So just a bit of housekeeping to begin with. We're going to spend an hour here, and we won't go over the hour. We won't hold you longer than that. We know a lot of you are on your lunch break. We are recording this, and that is so that we can send this can have a life beyond this, and in terms of access as well. If you wish to ask questions, please do all the way through. Just type it into the chat and the Q&A. We hope to get to it. We will have the panelists are going to speak for only a short period of time each, and I might get quite disciplined on them, but I think they're quite disciplined themselves. So we have left space for a conversation and to explore just the synergies between the three presenters and the three pieces of research that we're going to be talking about. So the order of speakers we have today, because essentially we have three layers of research and knowledge being generated around sexual violence here, and we're really delighted and privileged to have all three represented here. So first up, we're going to invite Helen McGrath from the Central Statistics Office to present on the sexual violence survey that has just been completed this year. She is a statistician within the CSO, and she has been project managing the sexual violence survey since 2019, and bringing it to its conclusion. And indeed, it's still, if you like, rolling out at the moment, because the vast amount of research and the data in there is being released currently on an ongoing basis, and we're still mining it, we're still learning from it. And then I'll come back in briefly and introduce our own research from rape crisis centres and from the survivors using rape crisis centres and accessing rape crisis centres. And Elaine Mears from the RCNI will speak to that research, and in particular we'll be looking at the some of the recommendations within the Grevio report, which is on the Istanbul Convention, which has just came out this month, and that points to a number of things that we need to be doing better in Ireland. And Elaine is going to reflect on how our data speaks to those issues and provides a roadmap for us there. And then she will introduce through to Diogo Costa, who is here with us from the European Institute of Gender Equality. And he has been tasked, as part of the team, been tasked with the knowledge of sexual violence across Europe. No small task. And he's going to tell us something about that project and how we understand sexual violence across Europe, or gender-based violence more broadly across Europe. And then we're going to, as I say, come back as a panel, and we're going to have Q&A. And as I say, I'd invite you to put your questions in as we go into the questions and answers. But also, if you'd like a hard copy of our report, if you can email comms@rcni.ie, and I will type that into the chat so you can see it. Louise can send you out a hard copy. We have a limited print run, but there should be enough to go around if you really want a hard copy. Some people really like there's still an attachment to the physical, even though we're trying to move paper free. So first up, and without any further from me, Helen, can I invite you?
Indeed, you can. Can everyone see a screen there?
Yes, think.
Perfect. Excellent. Okay. So thanks very much, Cleona, for that. And look, I'm going to talk today about some of the work that we've done recently in the Central Statistics Office in this space. And this probably sets that kind of wider context for the information that you'll see coming from the RCNI Rape Crisis Statistics 2022 publication. So I'm going to talk about the Sexual Violence Survey, which is, as Glenn has already noted, we published this year, and it's been a vast body of work behind the scenes to get to publication. And what I'm going to be talking to you today is going to look at what the Sexual Violence Survey is. So I'm just going to remind some of you who may have heard of it before, and for those who haven't, I'll just introduce it. And I'm just going to touch on some of the results, looking at the overall prevalence and some interesting statistics on disclosure as well. So just looking at what is the Sexual Violence Survey. So this was, and its primary aim was to capture the prevalence of sexual violence in Ireland. And this all kicked off from a scoping group report published in 2018, which made the recommendation a survey like this should be conducted. This was a household survey, using a randomly selected sample, mix of ages and sex from all across Ireland. And we had no knowledge of their prior background or their lived experience. And one person aged 18 and over was asked to engage on the survey, and this resulted in nationally representative results on this. So this is very much a sensitive topic, sexual violence, and the underreporting risk had to be managed throughout the survey. And we had many ways and means that we tried to, manage that risk, looking at the choice of mode, looking at, the types of concepts, trying to make sure that we were clear on the concepts that we were using very specific types of questions as well, and kind of, using our kind of best practice experience in terms of questionnaire design. Another point I just want to note and share as well is that research shows that society's awareness of violence can impact on the reported or disclosed levels of violence in society. So this survey represents I suppose the closest we can get to the true prevalence of sexual violence in Ireland. So I'm just going to touch on some of the concepts in the sexual violence survey. So just, I suppose, to outline, we used kind of consent principle to kind of gather people's experiences. So this is where we asked people whether a certain experience or behavior happened without their consent. Just to note that when you see some of the figures, I'm going to talk about adult and childhood experiences, and we use the age of consent, i.e. 17, as that cutoff point between them. You may also see different language used to describe experiences. So, for example, non-consensual was used for adult experiences versus unwanted, which was used for childhood experiences, because consent isn't really kind of an appropriate concept as people are under the age of consent. I'll talk a little bit about the sexual violence definition in detail, but just to be aware that childhood sexual violence includes non-contact experiences. And just to note and remark that the survey was asked of adults, but it asked them to think back to their childhood and whether they experienced certain sexual violence experiences as a child. So it doesn't provide insights into the current levels of child sexual violence. So I'm just going to touch on the sexual violence definition that we used for the survey. So we looked at national, international research, and we came to this kind of overarching kind of variable lifetime sexual violence. This includes whether you experience sexual violence as an adult or as a child. And we've used quite a broad spectrum of behaviors as well as part of that. So while violence, I suppose, can be often used and meant with force or the use of force, it can also mean having a marked or powerful effect on someone. So you can see in our kind of definitions and kind of underlying variables that we have a broad range, going from unwanted non-contact experiences for sexual violence as a child. This would be where you are exposed to pornographic material you didn't want to see, whether someone masturbated in front of you, whether you were asked to pose for sexually explicit images or videos, onto whether it was non-consensual sexual touching, where someone touched your breasts or genitals without your consent, or you were made to touch someone else's breasts and genitals without your consent, on through to non-consensual sexual intercourse. So it's quite a broad definition, but I think it encompasses a spectrum of sexual violence experiences. And I'm just going to look at, I suppose, some of the headline figures that we got in the survey. So looking at this, what we can see here is 26% of adults in Ireland had experienced sexual violence as an adult. 29% of adults in Ireland had experienced sexual violence as a child, and 40% of adults had experienced sexual violence in their lifetime. And just looking at, I suppose they're quite stark figures, but when you drill down into the data, you see different stories emerging. So you can see, looking at it broken down by sex, we can see a clear sex difference where men are experiencing sexual violence to a lower level than women. So what you can see here is 12% of men aged 18 and over had experienced sexual violence as an adult, compared with 39% of females. 22% of men aged 18 and over had experienced sexual violence as a child, compared to 36% of women aged 18 and over, and 28% of men had experienced sexual violence in their lifetime, compared to 52% of women. And looking again at not only by sex, but also by age, we can also see different patterns for different sexes. So you can see 39% of men aged 18 to 24 had experienced sexual violence in their lifetime, compared with 17% of men aged 65 and over. So we can see a clear age difference for men. And we can also see that clear age difference for women as well, with 65% of women aged 18 to 24 telling us in the survey that they'd experienced sexual violence in their lifetime, compared with 35% of women aged 65 years and over as well. So we have a lot of, I suppose, very interesting variables and statistics throughout the range of suite of 6 publications, but I'm just going to touch on some of the, I suppose, key points that might be more relevant for us to talk about today. So I'm just going to touch on the disclosure rates for those who experience sexual violence in their lifetime. So what we've see here is for men who experience sexual violence in their lifetime, 34% of them had disclosed to someone about at least one experience. So that, by disclosure, I mean whether they told one person, many people, or an organization. For women who had experienced sexual violence in their lifetime, what we're seeing is 53% of them had experienced, or sorry, 53% of them had disclosed at least one experience to someone from their lifetime experience of sexual violence. So it's an interesting kind of sex difference that we're seeing here. When I look at, I suppose, what we got back in terms of whether people engage with services, and by services here, we asked those who'd experienced sexual violence whether they had, used a medical service, whether they'd gone to a social worker, whether they didn't use any counselling or any other psychological support services. So what we can see here, interestingly, is that most people don't engage with services if they've experienced sexual violence. So for those who'd experienced sexual violence as an adult, you can see 79% did not use a service, and 81% of those who experienced sexual violence as a child did not engage with the service. For those who did use a service, what we could see in the data was that the vast majority of people will use a counselling or psychological support service. And for those who did use that particular type of service, they did find it very helpful. So that was quite an interesting kind of information that we got from the survey. I suppose one of the areas that's really interesting, again, for us looking at this, is looking at the reasons why people don't disclose generally. So what we're going to take a look at here is just looking at the reasons why, for those who'd experienced sexual violence as an adult, why they did not disclose. So what we're seeing here is 48% of people thought that what happened wasn't serious enough, that it wasn't serious enough to talk to someone about. 31% of people indicated that they felt ashamed or embarrassed talk about that experience of sexual violence they experienced as an adult. And 20% of those noted that they were under the influence of alcohol or drugs, and this is the reason why they didn't disclose to someone else. And looking then at, the reasons for not disclosing when you'd experienced sexual violence as a child. And interesting, we're seeing kind of a similar pattern in a way that most people identified that they thought that what had happened wasn't serious enough, 38% of people indicating that. That 29% indicated that they felt ashamed or embarrassed, and that was the reason why they didn't disclose the sexual violence they experienced as a child. 15% were afraid of their family's reaction. And what I find, I suppose, quite interesting, and probably not even interesting, probably more arresting, is that people thinking that what happened wasn't serious enough. And when you look at the range of experiences that constitute sexual violence as a child or as an adult, particularly as an adult, when you see it is very much non-consensual sexual touching, and that people don't think that that's serious enough. That's an interesting kind of finding that we've got from this survey. I could spend all day talking about this, and I know Cleona knows that only too well. So I have provided all the links to all the information there, and you can have my details are there for how to contact me if you have any further questions. And I'm going to hand back to Cleona now, and if there's any questions, I'll take them now, but I'll be around obviously for the panel, and we'll be able to take questions then.
Thank you so very much, and thank you for keeping it brief as well. We are at the huge challenge of asking these three researchers to really just give us a 10-minute highlight of the vast amount of information there. And of course, you know, of what you presented, I already have 101 questions, so I'm going to have to discipline myself as well to keep this moving. So we are turning next to Elaine and to the RCNI's data set, and this comes from the rape crisis centres who are participating in the database. The RCNI database, it is a representative sample of the survivors coming into NGOs in Ireland in terms of seeking support. The first thing that we were looking for was that we were conscious this year that we were coming out of the pandemic, and the question, you know, we had seen huge fluctuations in the type of demand and how people took services up, and how indeed people all over the country made themselves available to survivors in extraordinary ways through the pandemic. And the question, of course, we were all asking was what's going to happen after, and what will it look like after. And I suppose then, you know, we're ready now to look at, to compare with the 2019 baseline and say, okay, what are we looking into now post pandemic, if we can use that term, if that's true at all. But what we're seeing, of course, is that there is a 13% increase in 2022 on 2019 figures. And that's the amount of people using these services in this sample. So and there's increases across the board. So that is a pattern that we don't expect to go, that we expect that pattern to continue, and there's no reason to believe that it hasn't continued in 2023. So it will be something we'll be looking at as we go forward in the year on year. But as I said, Elaine's going to take us into some very specific pieces of data that she's pulling out of the research, and we're particularly looking at the roadmap that is presented by this data in terms of what the Grevio country report has said Ireland needs to do better in the next few years to be compliant with our international obligations. So over to yourself, Elaine. Thank you.
Great, I'll just jump in. So I want to begin by thanking all of the survivors, all of the supporters, and all of the service users of rape crisis centres who have entrusted us with their sensitive personal data. And as a result, this is why we have this report and this research. Rape crisis centre helplines are the primary and often the only way to contact a rape crisis centre. That means that they're a vital tool to enable rape crisis centre service provision. Without them, nobody can make contact with the rape crisis centre. Currently, 15 of the 16 rape crisis centre helplines in Ireland are provided with no state support and rely on fundraising and donations to exist. So in the recent review by Grevio that Cleona mentioned of this issue, it was recommended that local helplines be supported and funded so that they can be provided free of charge, extend their working hours, provide interpretation services, and offer direct support, information and access to counselling and advocacy appointments in local rape crisis centres. Rape crisis centres serve a vital function in their communities. And it's not just survivors and people supporting survivors who contact them and all of these helplines. They're also repositories of knowledge and information and support for a range of professionals, for researchers, and for lots of other types of individuals as well. And we see that in this graph here. So the majority, 80%, are survivors who are accessing rape crisis helplines. Then we have 6% are supporters, but 11% are professionals. So other professionals working with rape crisis centres and relying on them. Gender, sex, and age of victims are key variables in understanding patterns of abuse. And we see that within our own statistics, where 88% of survivors who come to rape crisis centres for counselling and support are women or girls. 11% are boys and men, and then we have 1% identifying as other genders. The sex of the perpetrator then, as is similar patterns in the CSO prevalence study and in other research, the vast majority of perpetrators of sexual violence are male. And we see 97% here are males and 3% are female. So gender is a key variable in understanding vulnerability to sexual violence and patterns of sexual violence. And what we see in this graph here is that boys' vulnerability to sexual violence decreases as they move into adulthood. So we have 77% of boys and male survivors attending rape crisis centres disclosing that the abuse happened in childhood, and that reduces then to 15% in adulthood. We see that girls' vulnerability, though, does not decrease to the same degree. There's a significant difference there. It decreases slightly from 44% to 40%, but not to the same degree by any means. Sexual violence is perpetrated against different age groups in different ways. So one of the things I was able to identify within our data set is that there are 3 distinct age categories that we identified, and were able to look at the sexual violence patterns based on those categories. So we have the under 13s, we have the 13 to 17-year-olds that I call teens, and then we have the 18 plus, the adults. And what we see for the under 13s is that sexual assault is the primary form of sexual violence that they are disclosing to us. 64%, 33% disclosed that rape is the form of sexual violence. Then that changes as they move into their teenage years. We see 62% now are disclosing that rape is that primary form of violence, and 35% sexual assault. And that pattern grows again and develops in adulthood. And we see 76% of adult survivors, or survivors of adult sexual violence, are disclosing that rape is the primary form of sexual violence. Now, it is important to note that because 88% of survivors attending services are girls and women, it means that they are driving this trend, and you're seeing that within this graph. So when we turn to the duration of the sexual violence, we see again differences in those age categories. The under 13 age groups, most of them are disclosing that the abuse was perpetrated over a year or over many years. In many cases it is. That changes when we move into teenage years, and we see that 58% of teens are disclosing that the abuse was perpetrated over an hour or a number of hours. And that accentuates again in adulthood. And we see 72% of those subjected to sexual violence in adulthood are disclosing that the violence was perpetrated over an hour or a number of hours. When we look at the relationship of the survivor to the perpetrator, we also see some key patterns here by the different age categories. So the under 13s, they are mostly disclosing that the sexual violence is being perpetrated by family members and relatives. And then a quarter of them disclosed that it was perpetrated by a friend, acquaintance, or a neighbour. Now, as children grow and they move into teenage years, their lives outside the home begin to grow as well. And we see that reflected here. We see that 52% of teenagers were disclosing that the abuse was perpetrated by a friend, acquaintance, or a neighbour. That again moves into adulthood, and the similar pattern, 46% disclosed they were abused by a friend, acquaintance, neighbour, and 23% were abused by a partner or an ex-partner, so intimate partner violence. And I want to go back and draw your attention to the 18% here for teenagers. 18% of people coming to rape crisis centres who were subjected to abuse when between the ages of 13 to 17 disclosed that the abuser was an intimate partner. The location of the abuse, it also mirrors really the information we're seeing around the perpetrator. So for the under 13s who are abused mostly by male family members, we see the abuse is taking place within the home. It's either the survivor's home or in the perpetrator's home. And often for children, those two things are interchangeable. It's probably the same home. Then we see for the teenagers, again, that violence is moving outside of the home dynamic. We see 30% disclosed it took place in an outside location or in a car. 27% of the perpetrators or the abuse was in perpetrators' homes, 19% in the survivor's home, and 23% in other locations. Now, the other locations for teenagers were friends, acquaintances' houses, schools, pubs, nightclubs, and a small number of workplaces as well. And then we see for adults, again, the abuse taking place outside the home in a lot of occasions. So we see 34% were subjected to the abuse in other locations. Again, friends, acquaintances' houses, hotels, pubs, nightclubs, workplaces, and also student accommodation is mentioned in here. 32% then was perpetrated in the survivor's own home and 22% in the perpetrator's home. So Grevio has highlighted the importance of employing an intersectional approach to ensure the accessibilities of services to all people. Women belonging to ethnic and national minorities and people with disabilities were given special mention within the Grevio report, as their access to specialist services is being inhibited by a lack of interpreters, an absence of cultural mediators, by physical accessibility issues, and by a lack of specialist training for staff. Within rape crisis centres, what we've seen is 7% of survivors, or 97 people, attending for counselling and support had a disability. 4%, or 47 people, were seeking international protection, they had leave to remain, or they had refugee status. And we also have a small number of travellers attending rape crisis centres as well. Good referral pathways and positive experiences of disclosing and reporting sexual violence are critical to ensuring victims' access to recovery and justice. So the vast majority of survivors self-refer to a rape crisis centre, 51%. And another significant source of referral is from health services, 29%. When we look at the disclosure patterns here, we see that for all age groups, that parents, other people within the survivor circle of trust, the Gardaí and medical professionals are really common for survivors' first disclosure of that sexual violence. The Grevio report has recommended mandatory training of healthcare staff to ensure they identify, properly care for, and refer victims to the necessary support services. And we know from RCNI's clinical innovation research that survivors who have a negative first disclosure experience are less likely to disclose again and less likely to seek help. And we see as well from the CSO prevalence study that females are more likely to disclose the abuse than males. So there are significant differences in the length of time between the sexual violence being perpetrated and between the survivor actually coming forward and seeking support from a rape crisis centre. So for those who are subjected to sexual violence when under the age of 13, we can see that the median length of time between the violence starting and them seeking rape crisis centre help and support is 31 years. 31 years between that violence starting and between them seeking support. This compares with 6 years for those subjected to sexual violence when in their teens and 2 years for those subjected to the violence in adulthood. It's noted in the Grevio report that there's a huge body of research that demonstrates that prompt access to specialist support services is central to reducing compounded trauma. And one of the key concerns that Grevio highlighted in Ireland's response to sexual violence is the inadequate geographical distribution of specialist support services, or specialist sexual violence support services. And that has led to long waiting lists in rape crisis centres, up to a year in some cases. The gap is noted and is particularly felt by specialist services which are operating outside of Dublin. So when we look at then reporting to a formal authority, we can see that 38% of survivors attending rape crisis centres in 2022 reported to a formal authority. The vast majority of those, 34%, reported to An Garda Síochána, to the police. So while improvements in policing were acknowledged within the Grevio report, a number of critical gaps were also highlighted, which the Gardaí need to be resourced and they need to be supported to improve on. And these included lack of comprehensive data from the police and courts, means that there's no clear picture of the Garda response. There's no clear picture of attrition rates and identification of gaps in the criminal justice response to violence against women. Police officers working outside the specialist DPSUs were said to have a persistent, insufficient awareness of a gendered understanding of violence against women, with reports of victim-blaming attitudes and trivializations of violence. And many reports of sexual violence that are made to the Guards by survivors, they're made within their local Garda stations, not to the DPSUs. So this is a really critical training issue that needs to be addressed. Grevio also highlighted delays in responsiveness to reports made by victims to the Gardaí. Now, in our own data, when we compared survivor experiences of reporting to An Garda Síochána in 2022 to pre-pandemic levels, we saw higher levels of sensitive Garda treatment perceived by those who were subjected to sexual violence in adulthood. However, those subjected to child sexual violence told a different story, with lower levels feeling that the Gardaí treated them in a sensitive manner, a reduction in the level of reports made to the Gardaí by those subjected to sexual violence when between the ages of 13 to 17, and lower levels of ongoing contact from the Gardaí throughout their case by those subjected to sexual violence when they were under the age of 13. Rape crisis centres also provide accompaniment services to survivors of sexual violence, and the majority of the accompaniments were made to the sexual assault treatment units, SATUs, in 22. 121 were made in 2022 to SATUs, 35 to court and 19 to the Gardaí. So again, the Grevio report highlighted that strong interagency partnerships make for effective responses to victims in SATUs and recommended a formalisation of the protocols around these. It also recommended increasing the number of SATUs and rape crisis centres in Ireland so that the EU standard of one service per 200,000 inhabitants is met. Mandatory training as well was recommended, mandatory training of healthcare staff operating in hospitals on sexual violence, and also ensuring through funding that a complete range of specialist support services, including legal advice, are available to rape crisis centres and to SATUs. Comparable data collection and standardised data collection are essential to forming a robust evidence base on sexual, domestic and gender-based violence. And it should be the foundational element to every policy, practice and decision in this area. So that leads me nicely to our guest speaker, Diogo Costa, who has a master's in health psychology and a PhD in public health, is a researcher in gender-based violence at the European Institute for Gender Equality. He is currently managing projects related to administrative data collection on violence against women and related to the development of indicators to assess different forms of cyber violence. Before joining AGA, he collaborated in several international research networks in the area of public health, social epidemiology, and health services research. The themes of the projects included intimate partner violence and domestic violence in the various stages of life, the promotion of mental health and mental health care among marginalised groups.
Thank you, Elaine. Good afternoon. I'll share here my screen too. Okay, let me know if you can see it, please. Yes?
Yes, it's working.
Thank you. Okay, so I'm going to briefly talk about some of the indicators of sexual violence that IGE, the European Institute for Gender Equality, has been developing in the past years, trying to measure this type of violence across the EU. And then I will also present to you some prevalence estimates that have been recently published by Eurostat specifically on this type of violence. So the magnitude or the size of this problem, violence experiences, could be measured through population-based surveys, as was already exemplified here by Helen, allowing to estimate the prevalence rates through counting acts or behaviors that are listed usually through tested or validated questionnaires, which are the most frequent way of measuring this phenomenon. This has been done at the EU level by the Fundamental Rights Agency back in 2012 and published in 2014 with an EU-wide survey that is now being replicated by Eurostat, and is also being complemented by EIGE and also the Fundamental Rights Agency. And I will come back to this study towards the end. But violence incidents can also be measured through administrative, routinely collected data from authorities and other organizations that record and process these cases whenever they are in contact with victims or perpetrators of violence. And this is particularly the case considering that most of these acts are criminalized across the EU. So EIGE started in 2013 developing this framework and set of indicators that aim precisely to measure different forms of violence, starting with intimate partner violence across the EU in a comparable way, and also in recognition of this type of violence as the most frequent that happened, and that impacted life of women particularly the most. So in very close collaboration with and consultation with authorities and relevant stakeholders from the member states, a set of 13 indicators were developed to measure intimate partner violence. And these cover these most common forms of this type of violence: physical, psychological, sexual, economic. And these are essentially collected by the police and justice sectors in each member state. Here you can see the list of these indicators. And so after mapping and developing these indicators, the next steps were trying to populate them. However, things are usually not that easy or straightforward. And behind each form of violence, there was, of course, work done trying to map what existed across the EU, the specific definitions that existed at national level in national legislations, relevant policy documents, etc. And of course, things are very different. I bring you here the example of sexual violence in intimate relationships, but this applies also to different forms to different extent. In general, there is a lack of commonly accepted and comparable definitions of sexual violence across the EU. And this, of course, impacts the availability and the quality of data, and ultimately the design of common ways to measure and tackle it. And so nowadays, we can only say something meaningful about any phenomenon if we can, of course, quantify it, so that any potential impact also of any intervention can be eventually monitored. But this design of policy measures is often hampered by this lack of harmonized definitions. So indicators suggest or try to suggest such comparable definitions to start with that could be used to measure violence, in this case, sexual violence. This was based, of course, on commonalities found across countries in the definitions, but also in international regulations. The Istanbul Convention, review reports were already mentioned here by Elaine. And of course, there are things that we can rely on to develop this definition and suggest ways to make them standardized and comparable. It is perhaps worth mentioning that there are other EU-level policies that are relevant for these efforts. And more recently, I should mention the proposal for a directive on combating violence against women and domestic violence that's been proposed by the Commission, that again defines several different forms of violence that should be tackled and criminalized across the EU. And this includes also new forms of violence, namely technology-facilitated forms of violence that are recognized. And EIGE, the Institute, also has a potential role here as a coordinating body for data collection across member states. So the main indicator that was developed to measure sexual forms of violence happening in intimate relationships is presented here. The title, Annual Number of Female and Total Victims of Intimate Partner, Domestic and Sexual Violence as recorded by the police. Very technical, but we have to do it. And as I said, most acts or behaviors that constitute this form of violence are already criminalized across the EU. So this is an advantage regarding its measurement, because we know that if countries have already mapped in their national criminal codes these offenses against international classifications, and specifically the international classification of crime for statistical purposes, this makes it much easier to retrieve from the existing databases common things that are share a common code. And so this is also similar to other exercises that member states already do to provide Eurostat with some data. And so that's also what we try to do, and is exemplified here on these technical details of how we collect information on this specific indicator. So we also know that these forms of violence are most common, as I said, within intimate relationships. So we want this information disaggregated also according to the relationship that exists between victims and perpetrators. And this is something often difficult to get. And administrative data sources because of their very nature, are not often developed to have this specific levels of disaggregation. And also some of these disaggregations are only relevant for specific types of crimes. So in the case of violence, countries may have a definition of, for example, domestic violence, which may or may not overlap with the definition of intimate partner violence. And this also may include other forms, including violence against children or other types of violence that happen within the domestic unit or domestic sphere. Or it can actually be separated, or like is the case, for example, in Spain, where it's possible to actually differentiate intimate partner violence from domestic violence, even in administrative data sources. So we started this exercise of trying to populate these indicators back in to 2018 and between 2018 and 2020, and of course faced all these challenges, and we also try to accommodate those challenges. This is now some of the findings from this previous exercise of data of administrative data collection conducted within the police and justice sectors across EU member states. Here I bring you just a glimpse of what was found regarding the specific indicator on sexual intimate partner violence. And in total, we saw that comparable data was available only across 7 member states that had the components of the indicator that we were interested that were available and comparable. That is, they counted victims or offenses of these specific acts. They had information disaggregated by sex of the victims, and also identified the victim-perpetrator relationship. And for the remaining member states, some of these components were missing, or data simply did not exist. And here, for the member states that actually had some data, I bring you some of the rates per 100,000 female inhabitants of women victims of sexual violence measured through this indicator. So for these 7 member states for the years 2014 to 2018. And as you can see here, a very heterogeneous picture with the low rates of recorded sexual intimate partner violence by the police, in this case, with less than 1 victim per 100,000 in Latvia, Lithuania, and Slovenia, and higher rates for Germany, France, close to 6 victims per 100,000, and Czechia and Finland close to 4 victims per 100,000. As you can see here, not all the years were also available in some of these countries. So we still have many issues regarding data completeness, data comparability, that are quite incomplete, particularly on these indicators that are based on the different sources. And this is even more pronounced in data from the justice sector. The reasons include, some of the reasons are listed here. Jurisdictions not recognizing intimate partner violence a legal offense, instead aggregating it as part of domestic violence offenses, as I mentioned. Jurisdictions not systematically recording that on victims and perpetrators and their relationship. National data collection systems using different units of measurement and different counting units. So police may use charges, investigations, offenses, suspects, victims, incidents, and or others. And also the link between data across institutions, it's also not optimal, and requires that this is standardized and uses the same counting unit, same language. Also, the rules to counting acts is also very relevant, because some countries use what we know as the principal offense rule, and others use multiple offense rules, meaning that they count from each victim either the most severe crime, or they count all the crimes that a particular victim was affected. And since we know that violence against women are based to a repetitive pattern, counting multiple units is often more helpful to acknowledge and to identify this continuum of violence than actually the principal offense rule. So this is something that is also different across countries. And yeah, all of this hampers, of course, comparability across countries. So I mentioned also in the beginning the prevalence data from Eurostat. So right before the pandemic, Eurostat started this EU survey on gender-based violence against women and other forms of interpersonal violence, the EU GBV study, that aimed to provide this EU-wide prevalence for different forms of violence experienced by women. The questionnaire that was used was pretty much the same questionnaire and indicators that were used by the Fundamental Rights Agencies, the Fundamental Rights Agency back in 2012. So to try to replicate the survey, and also to acknowledge some differences that happened in the last 10 years. So look at possible trends. However, what happened is that not all countries opted in this Eurostat project, and so IGA and FRA tried to complement this project by conducting the same survey across 8 countries that did not take part in the Eurostat project, in an effort to have this at least the EU 27 picture. Well, we know now that it's going to be EU 26, because Italy is doing its own thing, and probably at a later stage. And Ireland is actually included in this batch of 8 countries that IGA and FRA are covering. And so this is currently ongoing. So let's see if we also get this data from these additional 8 countries. But we already have some data that Eurostat published recently. Here are some of these recent figures. This is the prevalence of victims of sexual and physical or sexual violence perpetrated by a domestic perpetrator in adulthood. Women victims. The highest prevalence, as you can see, are found in Finland, Slovakia, Denmark. The lowest, Poland, Portugal, Bulgaria, and Montenegro. But you can see here how this ranges. So proportions going from 36% of physical violence in Finland, and only considering sexual violence goes to 13% in Finland, 15% Slovakia, 13% also in Denmark, to lowest numbers goes to 2%, 2.6% in Bulgaria, for example. When considering the prevalence of women victims of sexual and physical or sexual violence by any perpetrator, so not by just a domestic one, we see a rather similar picture, but with higher prevalence rates. Again, Finland, Denmark, and the Netherlands with the highest values. And here you can see close to 50% of the sample of women approached, or more than 50% in Finland, reported some type of physical or sexual violence during their adulthood by any perpetrator. And just considering sexual violence, this figure was 37% in Finland, 33% in Denmark, 38.6% in the Netherlands, and up to very low figures, again, in more or less the same countries as the previous graph. And the last one, looking at the prevalence of women victims of sexual violence and rape. And here it's since the age of 15 by a non-partner. And again, we see Finland, Denmark amongst the countries with the highest figures, 34% just for sexual violence by a non-partner in Finland, and almost 10% when considering rape. Bulgaria and Poland, again, with the lowest figures. So sexual violence and rape experienced by non-partners or outside of the domestic sphere seems also very frequent in these countries, which is also very worrying and dramatic. So we need to continue studying, of course, this phenomenon, understanding the impact of the methods that we use also to collect the data and how these impact. Also the levels of awareness that exist to violence against women, which can explain much of this variation also. The support systems in place that were already mentioned, the protection and the prevention measures in order to understand all these patterns and variations. So another thing that we also hope to be able to do in the future is to link and quantify how this administrative type of data links with the prevalence data and more precisely characterize and inform also member states on this in order to eradicate violence eventually. Thank you.
Thank you so very much. An absolutely fascinating walk through the challenges ahead of us, as well as how far we've come in terms of being able to measure. And of course, as you point out, there's some really interesting differences across Europe that aren't on the face of it, you know, that we can't take on the face of it. We have to dig deeper. And I suppose that's one of the questions that I always have with data. Sometimes the data seems to be really, really clear. It's like it's a nice, simple, here's the data. But actually, when you ask what that's saying, oftentimes what you end up with is, here's a whole other set of questions we need to ask to understand what that data is telling us. So, for example, why does Finland have, you know, if I asked it just on the face of it question, why does Finland have much more sexual violence than some of the other countries that were at the bottom of the scale? You know, how do you go about grappling with that question?
I might jump in with that, Cleena, just because it references a point I suppose I made in my presentation about, you know, I suppose the difficulties in collecting this type of data and how it's so nuanced, and how, you know, a society interprets violence can actually have an impact on the reported or disclosed levels of violence in society. So is it that Finland is just more open to acknowledging that these things have happened, that people actually recognize these experiences as being unacceptable and intolerable and are sharing that? Is it the question of trust within society, that they trust the organization that they're sharing their information with? You know, and you know, there's a lot of factors involved in this, which just, and particularly like anything we collect data on can be tough, you know, whether it's employment data, whether it's, you know, looking at income data or things like that. It can be very hard to try and tease out what it is. And this particularly is difficult, particularly with the additional sensitivities on it. How you collect the questions are so important as well. And the mode and way, you know, how you approach it, how you phrase it, that can also have an impact as well.
Yeah, if I may, just to back what Ellen is saying, yeah, we know this. We know that there are numerous factors influencing. The methodological factors are very important, of course, and this also happened during the pandemic, although it was planned before, collected during, and analyzed after, and so lots of adaptations had to occur. And this also has an impact because it's different if you are responding to an online survey, for example, because many countries use this mode of administration, or if you're answering a questionnaire with an interviewer that is asking you, or if you mix this type of modes of administration of questions, the list of behaviors and acts that you are asking that compose an indicator of sexual violence, for example, which can be 10, can be 20, can be less, and can be very severe acts, or can be very less severe acts if these exist. But this is also it's also very sensitive, all the figures that we obtain in the end to all these elements. And of course, the awareness that exists in a particular society towards what is an act of violence is very much important. We know this. And if I may just bring in another element here, one of the things that also is striking is that we know that some of these countries that present the highest prevalence rates are also countries that rate high in the gender equality index. So we're talking about societies that are generally equal or compared to others that present lowest levels of violence, of all types of violence. So this creates a bit of a paradox. Actually, it's known by this, that some researchers try also to understand what's happening. And this plays a huge role, the level of awareness and how people perceive the acts of violence within their society, the things that they experience on their relationships. But we could talk all afternoon about that.
And if I can move it along when I come back to you, Elaine, here is, in terms of the national level, then, we have our set of data here from rape crisis, and we have the prevalence with the CSO. And then there's gaps. Grigio said, look, there's all these gaps. Why can't we just, nice and neat, count at every stage and compare it all together, and it's all one big pot, and we know exactly what's happening to survivors. Diogo has talked a little bit about the European challenge there, but what's the national challenge on that?
Well, lots of challenges, but also lots of synchronicities, actually. We have a good sector. We've a sector that's 30, 40 years old, and it very much is, community-based, built from the ground up, survivor-centered, has all of these really strong principles. It makes me think just what Helen actually mentioned there. We're both talking about the methodology and how you collect the data and the uniqueness of each of the different data sets as a result of that. So within our own data collection and rape crisis, we don't go into the counselling room, or we don't ask counsellors to go into a counselling room and start rhyming off a list of questions for survivors. The data collection is very secondary to the counselling and therapy process. So it happens, we have like a living data collection system. It's updated gradually as we find out more information, or there's a picture been built around the survivor. So it's in the process of counselling. It's secondary to that counselling that the data is learned, basically, and entered into the system. So that's a huge advantage, I suppose, to administrative data collection that we have when you compare it to the different methodologies, obviously, of the CSO, who worked for 5 years on the national prevalence study and had a fantastic collaborative approach with the different agencies in Ireland who work in sexual violence, and really learned from that and took from that and valued the expertise and created this very culturally appropriate tool, basically, to collect the data, and dealt with COVID as well in the middle of that. And then also you have the cultural and national and international barriers, I suppose, then with the AGA and the FRA and, that level of data collection. And it's trying to find all those commonalities, the common language between them all, and the standardized indicators and definitions. So that would be, I think, key.
And I know that I invited questions, and I know I said we'd stick to the time, so we have a very short window of time left. So but one question just leading on from that, Diogo, you said that 7 countries had comparable data on the indicators, and that's obviously a small number. And I mean, we did some work, and Elaine led out some work on comparable indicators and definitions here as well, particularly around sexual violence against children. And I suppose if we're making the move from prevalence to administrative, and maybe we need, maybe we will always need both, but those comparable indicators, like Diogo, if we're moving from 7 to the full, the 20s in Europe in terms of comparability, how are we going to get there? And I suppose you mentioned the EU Victims Directive coming out, sorry, not the Victims, the Violence Against Women Directive coming through. And I think one of the most controversial pieces is about definitions, isn't it? How we define sexual violence.
Yes, specifically about the issue of consent and regarding rape, not as much as the other forms, which are a bit more agreed or consensual, let's say. But we are now in the process of doing another round of data collection, of administrative data collection, with the providers from the police sector, the justice sector across the EU. We refine these indicators, taking into account the feasibility that member states had that included all these difficulties that Elaine pointed, Ellen also mentioned. We had to drop some of these very restrictive requirements. And we are in the process right now of collecting that data. But we can see that we will have more information from Ireland, including, because I'm actually dealing with this also. And this is very, very encouraging, because it shows that it's possible. I started by saying that I started this work 10 years ago, and so precisely we're trying to come up with common definitions, agreed definitions, standardized ones that could be used by everybody, but then had to basically not take a step down, but a step to the side or larger, to encompass all the difficulties that were found to reach this comparability. And I guess we are in a good path to that. And of course, all these legislative pieces and instruments recognize this and will help us eventually. I do believe that we more and more will have this type of comparative data, and we'll have institutions talking to each other, exchanging data, which is also not easy, because there are lots of ethical and data protection issues that need to be accounted. So, but we're moving, and I mean, awareness is raising everywhere, which is good, I think.
Absolutely, and I suppose we started our own journey, I think, probably almost 20 years ago on this, and I think, you know, excellence at every level is really what's needed in terms of really having that, ultimately ending up with the goal of comparable data across, so we can tell the story all the way across the journey that the survivors take, from when they're targeted and from violated. Helen, I said that was the last question, but the very last question. We've been talking about administrative data here, and you've been talking about survey data. And you know, in terms of this looking into the future, and if this administrative data, if we have it comparable, if all of the agencies are doing a standard and comparable and excellent piece of work in collecting that data, whereas, you know, the hand and the partnership between survey data and administrative data, will that continue into the future, or will there be a point where we have it all in the administrative data?
Collecting survey data is incredibly expensive and costly. It's also expensive in terms of respondent burden as well. You know, so I mean, if I could wave a magic wand, I would love to have, you know, people talking about their experiences and getting support and using that kind of structure of the counselling, collecting that nuance of the data, and be able to do that. That would be ideal. But we're not there yet, and it'll take us a long time before we get there.
It would also, of course, be that we're not going back to anyone there. You know, we're collecting that data in the immediate, and it's secondary to the fund. It's centered on the survivor. Yeah, absolutely.
I mean, a lot of the issues in terms of collecting data, you're trying to, as much as you can, protect respondents, protect all the staff involved in collecting such in particular the respondents. So, and you know, a lot of you know, when we're looking at the data coming back into the office, you know, I just know they're not just figures, they're stories of real people's lives who are sharing that information, and we wouldn't be able to publish it without that. And it's something we're always very aware of in the office, that cost for respondents engaging in our surveys.
Well, I think, thank you so very much. I am going to wrap it up and give you that last word, because it is ultimately about telling that story, and hearing that voice. So we have a lot of work to do. We're on it. We're halfway there, maybe a third of the way there, optimistically, and we know that we have the roadmap set ahead of us. So thank you all very much. It's been a fascinating conversation. I hope you've all enjoyed it. Well, we will be sending the recording out, and it will be available on the website. Thank you.